Welcome to today's lecture series on from Amazing Grace Fertility Specialist. My name is Dr. Chukwugbo. Today, I want us to talk about impotence. This is one of the neglected factors when we are discussing infertility, because infertility is a cause that is something that affects about 40% of the couples. And then majority of the time, the male factor takes about 50% of that, while the female factor takes about 50% also. But most of the time, the female factor is what most people focus on. With the male, especially in this our environment, with the male being adjudged to be always normal. But that medically is not always the case. So today, I want us to look at one of the common things that affect men, which is impotence. And then because of the stigma that's associated with impotence, most people don't want to talk about it because environmentally and socially, men have been made to believe that they are always okay. So the brunt of childlessness is usually being borne by only the woman. So the male, actually, impotence is the inability of a man to maintain, to get an erection or maintain an erection for the purpose of sexual intercourse. And when this occurs, it leads to one of the common causes of infertility. One of the commonest causes of impotence, one of the types of impotence you have can be, impotence can be a psychological problem when we notice that it occurs suddenly, or it can be an organic problem, in which case there is a causative factor within the person that leads to infertility. And these causative factors can range from either a neurogenic cause, maybe the person has a spinal cord injury or one of those cancers that affects the male, or even the prostate, enlargement of the prostate. It can give rise to impotence. It can be also due to a venogenic cause, which is this venogenic cause is where the commonest cause of impotence, in which case the veins, the kind of leaking is leaking from the vessels and then making the man not to maintain an erection. So that's the commonest cause of impotence. Then you can also have atherogenic causes also, especially in people that have something like hypertension and they have develop something like atherosclerosis. That is, what we mean by atherosclerosis is when the vessel, as somebody is having high blood pressure, over time, the vessels, the small vessels that supply the penis, the small vessels, those capillaries that supply will get thickened. That is, the walls of the vessel get thickened so that the arteries don't get enough blood to its location, which is the penis. So it makes the penis not to get full blood supply, and then it causes the person not to have an erection. It can also be as a result of endocrine and endocrine cause. Endocrine in the sense that somebody can have testosterone abnormalities or estrogen abnormalities, and this leads to the person not being able to maintain an erection. The diabetes is one of the common causes also that gives rise to impotence. Usually when somebody has this impotence, when somebody has diabetes that has been going on for a long time, it also follows the pathway of that thickening of the blood vessels. So that gives rise to the inability of the person to maintain an erection. So usually the symptoms of this impotence is self-observing. The man just notices that with his wife, and he could not be able to maintain an erection, or he gets an erection before he penetrates the woman, the wife, the penis falls down. So, and this is a very, 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 very embarrassing situation. And then most times, because of the stigma that's attached to it, they don't want to seek care. They get themselves involved in so many other things that give rise to that try the aphrodisiacs. They take aphrodisiacs. Some people take drugs, unprescribed drugs to try to treat this condition with varying effects. Most times these things don't work because the basic cause has not been defined. So people that have a sudden onset of impotence, usually due to stresses of life. Maybe the person has just been, business is not doing well, or any kind of stress can make a man just to lose his ability to perform his normal duties as a husband. So what we do with impotence is to try to define what is the cause of the impotence. When you are trying to manage the person, is to define what is the cause of the impotence. Is it something that is psychological, or is it something that is organic? Is it organic in the sense that there is a causative factor? So you have to take a very good history from the patient to determine what actually is the cause. And then from that history you've taken, you'll be able to define what you are dealing with and how you go about it. If it's something that is organic, that means you have to treat the underlying condition. If somebody has diabetes and is unwell controlled and is having erectile impotence, then you have to try and control the diabetes. If somebody has hypertension and the BP is uncontrolled, you have to control the BP. So you have to define what the cause is before you can actually start talking of medication or whatever, any other methodology you want to adopt to manage it. For people that have a psychological cause as a result, as a pointer, or as a result of stresses of life, you have to also do some form of counseling, being able to counsel the person and then be able to define that which is the cause of the problem, and then be able to take care of that condition. People that have impotence also, you have to, as you're counseling, there are several methods you can adopt to manage the person. You can adopt like people that have erectile impotence. In addition to erectile impotence, you also have forgot to mention also, we also have ejaculatory impotence also. But we're concentrating on the erectile impotence because that's one of the commonest ones. The ejaculatory impotence is an impotence that develops when somebody has an erection for prolonged period of time without getting to oxygen. Person doesn't get to ejaculate. He doesn't release sperm after being with the wife for so prolonged period of time. Most times it's usually due to a psychological problem. But the one that is commonest is the erectile impotence that gets up doesn't get up at all, or gets up and falls before penetration. But we should also bear in mind there's ejaculatory impotence, but it's not as common as erectile impotence. So for somebody who's developing this erectile impotence, there are various things you can do, various maneuvers you can tell the person to do. Like, for example, the person can start trying things like increasing the amount of foreplay before you penetrate. It will help you to calm down and then be able to relax and then be able to engage with a relaxed mind in the sexual act. If the person can also have something like you as the person is you don't just immediately you meet your wife, you don't just penetrate. You can just have some time, discuss, so the system will calm down before you start going into this. And there are other things you can do. You can also use some form of exercises also, because sometimes some of this impotence is as a result of problems with the pelvic floor musculature, which if you can straighten the musculature of the pelvic floor, it can give rise to amelioration of all these complaints. So you get things like Kegels exercises, you can do like squatting, you can do like aerobic exercises. All these are methods that can be have been tried and be found to be effective in dealing with erectile impotence. There are drugs also that can be used to treat impotence. Also, there are drugs that can be used. For those drugs, you need to consult your doctor so that you look at your general health and then determine what is best for you to treat the impotence. Thank you very much.